Sorry guys, the doctor was in here. He's left. I'm waiting for a knee brace for my left leg. I'm also waiting. I have a walk-in shower, so I'm gonna need a heavy-duty shower chair. So I do have I take Tylenol. Much pain as I be in. I just do the Tylenol and a rub. The reason I'm having the surgery is because nothing helps. Not shots, cortisones. None of that helps. He just discussed the in and out, the maybe some blood clotting possibility. When you have surgery, a little bone can be breaking. They may have to fix that. So I am getting another knee brace for my left leg to support that. I did ask because I do have to have both knees done, but they suggest one at a time.
Said to get you some stuff. I just wanted to make sure when I put it in the computer, I want to make sure I get it right because
I have some things for the pharmacy.
Yeah, that's what I was going to check on.
He went up 75 on the.
Well, that's the Clofenac, right?
Yeah, and the cream. I get both. It's the rub and the pill for the inflammation.
The cream and the pills, they don't cover at the same time. The insurance.
Yes, I do. I get them all the time.
Okay. I'll send them. I just wanted to give you
I never get one. Yeah, I never get one without the other. It's called, I get it here at the Temple.
Do you get everything here?
Yeah. It's lactate, 12% or 5%, something.
Okay.
It's a cream for my skin.
Okay.
Would you see it in there?
Yeah, I gotta pull it up though.
Oh, okay.
Trying to make sure I don't send the wrong thing.
The knee brace for the left leg.
Yeah, we'll get you the knee brace and the knee brace and the shower chair. Those you gotta call. Well, I'll give you the card.
Well, I was told to get the prescription from here and then send it into my insurance.
Okay.
Or if here, or they can recommend like they did last time when I got my knee brace.
We have a card of a guy.
Yes, and then I call them and the prescription will go to them and they will come out to the house to measure.
Yeah.
Okay, so that's okay with that? We okay with that one?
Yeah, I gotta put it all in, but I just wanted to check the cream, make sure I'm not sending the wrong thing. So.
Okay. And my Tylenol.
Yeah.
Yeah. So that's basically it. I just do the rubs, the Tylenol, and the my lotion for my skin. I've been doing that for years. Just the lactate. It should be in there. My medicine comes from here.
Oh, okay. Do you usually get it from your primary doctor, Dr. Kaplan?
I don't even have my primary doctor right now. That's why I asked my orthopedics to put it in.
Yeah, it's in here. So let me just get everything sent real quick.
Yeah, I don't even have that right now. So that's why I asked him, could he get it for me? Because I've been using it for years. It helps.
I got to get your paperwork for surgery, too. So I'll be right back.
Yes, thank you so much. If you don't know your business, they'll tell you anything. I've been getting at the Flexinate and the pill and the cream. One is for information. Both of them are for information, and one's a rub. It's best to ask all your questions. So I'll be coming back and forth with some questions. I gotta get to the dentist. But it's good to ask a lot of questions. Whatever's on your mind, the ins and outs. Surgery is not a joke. My first time ever having surgery. I'll be 64. Am I scared? I am so scared. Yes, I am. Now, I don't know if I want to go in rehab or go home. That's the question. And I forgot to ask them. Maybe when a person comes in, I'll get to ask them. But I was thinking rehab for at least 2 days. I get home, I get too relaxed. Let me see. I've been sitting there on my videos all day. It's kind of chilly outside, so I had put. Oh, what is my banana? I had put on this suit because I didn't want to wear a coat, so I put on the pants and jacket and match. This is all I needed. I ain't liking this wig, y'all. I just hate to make my appointment. I like my hair or my braids. But when you're trying to make your appointments, sometimes you have to grab a little wig. And that's what I did. I ain't say nothing. Like 100. When I first came here, it was like 198. I'm solid. Alright, but I'm 200. I gotta lose some weight. Since I'm getting this surgery and I'm carrying all this weight, I think it'd be much easier. I don't even know what time it is now. But I've been here since 1:45, I think. Whatever time my last video. I don't expect anybody to be in here because I don't go live a lot. And my lives help me. I do post a lot. So let me come on here. These people don't know me. I don't know what else I'm going to do today. I might bake some cakes. Depending on how I feel when I get out of here. A lot of things I want to do. I want to go to the supermarket. Pick up some goodies. I'm out of flour, so I can't bake a cake. How you run out of flour? But I did. I'll figure something out. We're going to do something else. Go home and get on my treadmill. Oh, y'all need to see how. Wow. Go on my treadmill. I am big. I'm sick. I'm not big. I don't say I'm still built. I'm still stacked. I kind of like this. The thing with these, they just like to rise up on you. You know that glue they put across here to keep the lace front? I probably need that to put in the back, y'all. Just keep rising up like that. I'm going to put some of that glue in the bag. I don't have my eyelashes on. I don't have no nails on. No eyelashes. I'm ready to get out of here. You know when you're ready to go and start getting restless and agitated like a kid, that's the way I feel right now. Ready to run around somewhere.
Alright. So,
Alright.
surgical paperwork wise, this is what we got.
Oh, when you say the surgical paper, something I was wondering, do they have, when do you go through the options of if you want to go home or if you want to go to rehab for a couple days?
Once the surgery is done and you're in the hospital.
Oh, that's when they ask you. They don't ask you before.
No, it depends on how you're recovering from surgery.
Exactly.
We
Okay.
don't know that until you have the surgery. You know what I mean?
Oh, okay. All right.
So you fill out the paperwork here,
Yeah.
right? Fill out your basic stuff at the top. You don't have to worry about the two things I put X's next to. Okay? So fill out this stuff. Check the boxes over here to answer these questions, yes or no. And then sign a date. All right? The rest of the paperwork is the consent for surgery, so it has your name and the doctor's name as well as the procedure, details, risks, and benefits about it. It's a lot of the stuff that they went over when they were in here just on
Can I
paper.
get copies of this?
You can. Yeah.
Yes, I would.
So
Right.
you just sign and date the last page if you're okay with everything. So we have you fill this paperwork out here, right?
Yeah.
Then we have you meet with our surgery scheduler at the front desk. All right.
Mm-hmm.
She'll schedule what's called pre-admission testing for you,
Mm-hmm.
joint class, your
Yes.
post-op appointment,
Yes.
go over all the logistics leading up to surgery,
Mm-hmm.
surgery, after surgery, and she can give you the copy of all this stuff.
Okay.
Right.
My prescriptions.
They're all going to go to the pharmacy electronically. He'll probably sign them after he's done patients today. So they
So I
might not
won't be able to get it today.
I'll be going to get it tomorrow.
I can call and they probably could deliver it.
Yeah.
All right.
All right.
Yes.
So work on this. I'll check back in a second. I'll get you the scripts for the chair.
I was getting ready to say the
I'll bring that stuff
chair
back in
and
next.
the.
Yeah.
You're gonna
Work
bring
on this
that.
for now.
So
Bring that.
do this.
Yeah.
Okay.
Yeah. Work on that for now. I'll get that other stuff, and you'll meet with Sylvia after you finish up.
Okay.
Finish everything.
Okay. So I'll wait for you to come back and get this.
Yeah. I'll come back and just.
All
a
right
second,
then.
all right?
Okay. It's a process. I'm filling out the initial paperwork for the surgery. Like, they weigh 198. They ask you a lot of questions. Do you stop or rest climbing steps? Of course I do, or I wouldn't be having this knee surgery. All I said. Kidney disease. Not that I know of. No liver problems. Sometimes I do have chest pain. I want to put this in there. Have you ever had a heart attack? No heart attack, but I do have some chest pain periodically. No, I don't take medicine for diabetes. Do you have bleeding disorder other than bleeding disorder other than No, I don't take a. Yeah, the stress bypass surgery. No, have you taken steroids? I do not take steroids. I am not on any medications. And I need to. Okay. Total knee arthroplasty. All right.
All right. Any questions?
It is something here about bleeding, and it was like sometimes I do have hemorrhoid problems. I did have a colonoscopy repair
Okay.
once or
Okay.
something like that. So I just put it there just in case he
Okay.
wants to consider any more tests.
Yeah.
I had to just be truthful with
Yeah, that's fine.
that.
That's fine.
Okay.
What we do is we send you to pre-admission testing.
Yeah.
Pre-admission testing, they do a whole bunch of blood work. They'll do an EKG. You'll meet with one of their doctors, discuss
Okay.
pretty much your entire health history.
Yeah.
And they'll just kind of, as they say, leave no stone unturned as far as your health history goes and make sure you're safe enough for the procedure.
What about cancer?
What do you mean?
Do they do any cancer tests or anything?
Well, that kind of stuff will show up in your blood work if it's
When do I get blood work?
at pre-admission testing.
Oh, I need to get that done now then. Date.
We'll just schedule for you. It's 4/9.
4/9.
April the 9th.
Okay. Well, I need to get that done before y'all get that done.
What do you mean?
I need to get other tests and things done. You saying that would be
pre-admission testing. So,
that would be before surgery.
yes, your surgery
Oh
is
no,
the
I
17th
don't
of
want to
June.
wait till that long to know if I'm cancerous or
You
anything.
can always go to your primary doctor. You
That's
can
what I
order-
said. I'm
Yeah.
going to make an appointment to get some other tests. So what all is with the pre
The pre-admission testing, they do blood work and EKG based on
blood work,
being admitted to have surgical procedure.
EKGs?
They just make
Okay.
sure that from a health standpoint, that's for doc to sign.
Okay.
Yeah. They just
We're
make sure,
talking. I'm just getting a little like.
they just make sure that from a health standpoint overall,
Make sure that's
you're
correct.
safe enough to have the surgical procedure done,
Oh,
and that nothing's going to happen to you
exactly. Okay.
during the procedure that's unexpected.
So that has to be done right before the surgery.
No. That has to be done within 30 days of the surgery.
Oh, okay.
So, like I said, from here, you have a seat in the waiting room, right? Sylvia's going to call you up to the front desk, and she's going to schedule a couple things for you. One's going to be the pre-admission testing. Right?
Okay.
And she'll schedule it based on your surgery date. So she'll schedule it likely sometime in the middle of May. So the middle of next month, about a month from now.
My surgery is what, June 16th?
17th.
Oh,
Yeah.
my work says the 16th. I don't know where.
17th a Monday. So if you're talking about the 16th would be a Sunday.
I don't know where at this June 16th in my head.
Yeah, 17th a Monday.
Okay.
I can double check it, but yeah. 17th a Monday. He operates here at Temple on Monday. So if you're looking at that Monday in June, you're looking at 17th.
That's another thing. Won't be no students working on my surgery. That's what made me get him, because the lady that works here said, she's good.
He does it. He does it nuts to bolts. So
all
he
right.
does everything. So, all right. So all the medications are going to send to Temple Pharmacy a little later. The creams, the gel,
Yeah.
Tylenol, the Voltaren. All that stuff's going to go to the
And
pharmacy.
my lotion.
Yep.
You have that down?
Yep. I have it all down. All right.
And I can
The
call them
shower
tomorrow.
chair and the brace, right?
Yeah.
You can call our guy Sergio. He'll deliver everything for you. All right, so that's everything for the shower chair and the brace.
I have another paper where they gave me another one time where they came out to the house. Now, I don't know if they come out.
He will come out to your house.
That's for the
just call Sergio.
The knee brace and the heavy duty shower chair.
Mm-hmm.
Just call him and he'll bring it out. All right. I know that's right.
All right. So from here, just have a seat anywhere in the waiting room.
Okay.
Like I said, Sylvia will make sure everything's finalized for you, and she'll give you a copy of this.
That's a copy of
the consent and the form you filled out.
The consent for surgery and okay.
Yeah, she'll give you a copy of all the stuff on the way out.
All right,
so
thank you.
Have a seat anywhere in the waiting room, all right?
Okay. All right, y'all. Let me go. I'll be back.